Hey everyone, I'm Jordan Lapierre, Director of Public Relations here at the Partnership for Public Service. Welcome to the first event in our Sammies Summer Series. Today we're talking about improving the customer experience. More citizens are engaging with the federal government on digital platforms, expecting quick and easy access to federal programs and benefits. And today we're going to explore how customer experience matters to the American public and how it connects to improving trust in government. So with that, I'd like to welcome our two guests for today. First, we have Andrea Fletcher, as Sammy's Emerging Leaders finalist and Chief Digital Strategy Officer for the Centers for Medicare and Medicaid Services at DHS. Hey, Andrea, nice to see you.
Hi, it's nice to see you as well.
And we also have Kyle Gardner. He's also an Emerging Leaders finalist and a Senior Policy Analyst with the Office of Management and Budget. Hi, Kyle.
Hey, Jordan. Hey, Andrea.
Hey,
So,
Kyle, how's it going?
Good to see you.
Thank you both for joining us today, and to our audience, thank you as always for tuning in as well. You can be sure to drop your questions in the chat, and we'll try to answer a few of those at the end of our conversation today. So before we dive into customer experience, I'd love to hear more from each of you about your roles, what you do day to day. Kyle, let's start with you on this one.
Sure. Thanks, Jordan. So again, my name is Kyle Gardner. I work at the Office of Management and Budget, and within that, an agency called the Office of Information and Regulatory Affairs. I've been here for about 6 years, and at OIRA, we basically do two things as desk officers. The first is that we are sort of the clearinghouse for regulations that agencies are conducting. So an agency will work on a regulation internally, and then they'll circulate it to my agency, and we are responsible for coordinating sort of the cross-government review of that regulation, as well as some specific focus on sort of ensuring that the analysis is optimal, that the agency is selecting from a series of alternative options, the one that is sort of net beneficial. And then the second half of our job, and I'm sure we'll be talking about this a lot today, is our work under the Paperwork Reduction Act. And this sounds kind of crazy to hear from an outside perspective, but basically every form the federal government does has to come through my office for review, and it has to come through at least once every 3 years, as well as anytime something about it is changing. So those are the two things that we do at OIRA as desk officers. I personally work with HUD and Social Security Administration most of the time, and it's a great job.
Awesome. Thank you, Kyle. Andrea, over to you.
Okay, so I sit at the Centers for Medicare and Medicaid Services. We oversee major programs like Medicare, Medicaid, and the Marketplace, or healthcare.gov. My role at CMS is kind of dual-hatted as well. So I oversee and lead a team of really fantastic technologists who come in on a tour of service and called the Digital Service Team at CMS. And we're the Fix-It Squad. We show up when people have tough technology problems. We help them work through it. We just help different parts of CMS, because CMS is so massive, really think through what are the challenges that they're facing, and how can we solve them with technology. My second half of my job is advising senior leadership at CMS on technology. So I am often part of key decision-making around, right now I'm working a lot on artificial intelligence, but also on data policy, on anything kind of related to technology and policy. I'm often in the room or at the table, kind of, bringing in my background in healthcare technology into CMS to try to help push us in the right direction.
Awesome. Thank you for sharing. Andrea, we'll keep it for you. And for those in the audience who might not be familiar with the term customer experience, could you explain, in your view, what that is and how you view customer experience, or we could use the shorthand CX if you like, through your work?
Yeah, so how I view CX. So I think about customer experience for CMS as like, what is somebody who's engaging with Medicare, for example, what is that like for them? When I think about CX, I often think about how my grandparents signed up for Medicare. So my grandparents would have signed up for Medicare by going physically to a Social Security office where they lived in Western Pennsylvania, and they would have signed paperwork. And it would have been submitted to the government, and months later, they would have been mailed a Medicare card. That's very different. My parents actually just signed up for Medicare a couple of months ago. Very different than the process that my parents went through, which is an online experience, right? Like, there's a different expectation. There's an expectation now that you will go online and fill out a form that then Kyle approves, that Kyle has approved, but that you fill out a form and submit it. And then you instantly get, that service provided to you, because that's what we're kind of used to. That's how we bank. That's how we buy things. That's how we engage with the world often is online. And the future, so hopefully how I sign up for Medicare, that's going to look very different than what my parents did. Maybe I'll be using an app. Maybe I won't have to sign up at all. Maybe the government will just know and automatically sign me up. What is it going to look like for me is kind of the question, right? Is how we're thinking through customer experiences. What does it look like today, and what do we want it to look like in the future? And then how are we getting there? So that's typically how I think about customer experience. Hopefully I don't have to sign up for Medicare for quite a while.
So Kyle, why in your view, does the customer experience matter both for folks within government like yourselves and for the American public?
Sure. So I think why it matters is that the way that a program can be built can be from a lot of different causes, right? There's a law that's passed that Congress assigns certain duties to an agency to execute something. There are certain resource constraints surrounding how they can administer that program. So we can keep running with, for example, Medicare sign up for a minute here. But at the end of the day, there's a human who needs a service, right? They need healthcare because they are elderly or disabled, and they need to know to seek out that service. And the logic behind the bureaucracy, the organizational structure, the funding, the resources, the law, and the constraints surrounding who are eligible for that is not necessarily aligned with that person who's thinking, I need healthcare, I am elderly, what do I do next? And so the goal of CX, in my vision, is sort of to bridge that gap and to ensure that as a government, as operators within that government, we're not just seeing things from the perspective of an employee within the bureaucracy who has sort of an intimate knowledge of those constraints or those requirements, but actually just thinking about it from the perspective of a citizen or a constituent on the ground who has that very central and critical understanding, I need healthcare, but may not have sort of a nuanced understanding of who do I reach out to get that healthcare? What forms do I have to complete? And so, ideally, it's sort of bridging the gap between that 10,000-foot view of policy and statute back to the human on the ground who needs a support or service or benefit.
So I guess building on that, when we interviewed you in the Sammies process, one of the things you said that stuck out to our team was that the federal government can feel big and these approaches can help make it feel a little smaller. So how does this CX work help make government more accessible for the public or feel a little smaller or more attainable?
Yeah, absolutely. So, again, I mentioned this at the outset. I'm in the Office of Management and Budget, and to some degree, we sort of have a coordinating role across the federal government. So it really is an incredibly high look at how policy is executed. And I'm always very conscientious about the fact that the words that I'm reading on a page are not necessarily what's being experienced by somebody at the ground level. And that's from the perspective of the citizen who's seeking a service, but also from the perspective of that frontline bureaucrat who's actually executing a policy that I may have reviewed in some capacity. And so for me, when I'm doing my job and I'm, again, a core part of what I do is that Social Security will send forms to me, and I'm looking at them for a variety of factors related to, do these questions make sense? What types of documentation is required to achieve responding to this question? I can try to intuit that as best as I can. I can try to think about, is this easy to answer or is this hard to answer based off of my personal experience? But my experience as, a 33-year-old male with a master's degree is not necessarily the same experience as, a 62-year-old or a 67-year-old who's seeking out retirement, right? And so I think it is core to when I need to actually figure out, is this a good experience? What are the burdens that somebody is experiencing right now? I turn to teams or I turn to individuals who are experienced in talking to constituents and talking to individuals about what their journey is. And it helps sort of center me in terms of understanding, do I have a grasp on what the burden is involved in this? Do I have a grasp on, if somebody understands the question, when did you become disabled? So it really is critical to take, again, a core question that's important for the government to know the answer to. If you're trying to decide if somebody's eligible for disability benefits, you need to know, when did you become disabled? But for somebody at the end of the line who's actually going through that process, that question of when do you become disabled can be a very hard one to intuit. And so to really, make the government intimate, make them understand what an individual is going through, it requires talking to that person or talking to a representative group of people who are like that person and understanding sort of what their experience is, and then trying to build back up from that, or try to rejigger what we've already got in place to try to match that experience a little bit more.
So, Andrea, your work really focuses on digital services, and I'm curious how those services play toward making government more accessible and reliable, but also, as Kyle was talking about the experiences of people at different ages, and you were mentioning how your parents and grandparents signed up for services. What are the barriers or challenges in having digital platforms being kind of the first place to go?
Yeah, so I'm happy Kyle brought up user research, because it's a lot of what my team does is we go out and we talk to people and we put prototypes in front of them. So we say, what jumps out to you on this website? Did we use the right language? How would you talk about this? And through that user testing and feedback and research, we iterate on websites, we iterate on content and websites. I think it's really important that the government uses plain language and the right language when, particularly in medicine, there's a lot of jargon, and in healthcare, to help de-jargon and make it so that people can understand what we're talking about. So we do a ton of user research. Our team also spends a lot of time doing user research with people who have accessibility issues with websites in particular, or any kind of online content that we're creating. So that's people who might have visual or cognitive impairments, people who are using screen readers to access the internet. We're often spending a lot of time looking at mobile devices, because a lot of people access information online on a mobile phone, not on a computer. And so we're kind of looking at these different groups and cadres of individuals to try to understand how are each of these people navigating the tools and the websites that we're building. It takes a lot of effort and a lot of time, but what always happens when we go through these really intense processes of user research and feedback is that we end up building the right thing first, right? So rather than building a website that people go to and they're like, this doesn't make any sense, I don't understand any of this, we get feedback like, wow, that's really easy to use. Or somebody said to us the other day, you're not treating me like I'm stupid or dumb, but I understand what you're saying. So making sure that we are really just like talking to them like normal people, right? But that conversation is happening on a website.
I wonder if you could talk a little bit about your work on helping people get the tools they need to fight surprise medical bills. I think this is a good example of I'm not coming to a government website to sign up for something, but I've got a problem and I think the government probably can help me fix it, but I don't really know how.
I don't understand the problem.
Right.
Yeah. So it's a really common issue. I mean, I personally have gone through this. I think many people have, where you get a medical bill and there's a bunch of jargon on it and you don't understand it. And you're sitting around the kitchen table in the evening with a stack of explanation of benefits and a stack of medical bills, and you're trying to figure out how much you owe. And there are terms like copay and deductible and out-of-pocket max, and you don't really understand all of that. And so we gave people mock-up medical bills, mock-up surprise medical bills, and we asked them to walk through what they would do if they received a bill like this and they couldn't pay. And through that, built a lot of content, working with the users kind of as we went along on what didn't they understand about the bill, what would they be looking for first? How would they go find this information? Where would they expect this information to be? We also worked with different patient navigator and patient advocacy groups on what they need, as well as our call center. We have a call center as part of the No Surprises Act that is helping people navigate through what processes. There's a bunch of government processes that you can go to. There's a bunch of forms that you could fill out. But what we don't want people to do is have to go through this really lengthy process of uploading documents and filling out a form if that's actually not the right place for them, or to fill out the wrong form, right? So really trying to help them navigate through the different options and through the information to get to where they need to be and get the help that they need. So we spent a lot of time just talking to users and putting things in front of users And so, it's on the CMS website now. It's medical bill rights. We've been doing a lot of work around patient rights in general and helping people understand, their rights in the healthcare system, because they turn to the government whenever they're in a situation that might be one of the worst days of their life. And they're really trying to figure it out. And so we want to be there, and we want to be helpful and informative, but again, have a pleasant tone. We all often say it should be a delightful experience coming to a government website, and it shouldn't be frustrating. You shouldn't be angry at us because we weren't able to give you everything that you need. But how do we help people navigate through their unique situation?
So, Kyle, a lot of your work might be something that people aren't super familiar with or that exists kind of behind the scenes. What are some of the ways that your work might surprise people in terms of how it impacts the experience that they have on a day-to-day basis when they're interacting with government?
Yeah, I mean, it's always just really cool being with Andrea on these things, because our work is just so co-aligned. It just feels very, I don't know, empowering to be with her. But again, in some ways, my role is sort of a backstop, right? Because an agency is the one that is working on, it has a law that it has to execute. It has regulations that then sort of fill out the details of the law. And a lot of the times, the way that the government actually interacts with a human being at the end of the day is a form. And when I say a form, it doesn't have to be a paper form, right? It can be a web application as well. But that is sort of one of the core ways that the government does its job, is through forms. And this law that was originally passed in 1980, and it's deeply, deeply obscure, basically says that when the government is designing a form, it needs to essentially ensure that it's only collecting the information that it needs to execute whatever service or benefit it's trying to provide to the individual. And then the information it is using is sort of appropriate to the task at play, right? And there are some other details there as well. But that's my responsibility ultimately, is that an agency will make that form as best as it can. And then my job is to sort of look over that and to sort of prod it and test it out and to say, are we minimizing that burden as best as we can? And is the information that we're collecting as useful as it could be? And so, again, as I said at the outset, I try my best to have an intuition over these kind of things, right? I try to look at a form and try to put myself in the position of somebody who would typically be completing that and try to think through how did I get to this point, right? What was the impetus for me trying to decide that I needed to complete this form in the first place? And then how do I execute it all the way through to handing it over to a field office or calling an 800 number and verbally giving the information or going online and giving that information? But a lot of the time, it involves a huge team effort, right? It typically involves me sending questions back to an agency. And sometimes I ask questions that end up being really dumb. And sometimes I ask questions that maybe help pull out a thread that hasn't been fully tested out. And so, one thing that I've talked about a little bit with the partnership, but I always like to emphasize this was genuinely the work of dozens of people, right? Is we had a listening session one time in my organization related to the form that you use for disability recertification, right? In SSA parlance, it's called continuing disability review. And the general gist here is the government provides a benefit to people who are disabled and can no longer work. And it's a critical lifeline for millions of people. And once you get on it, the government will check back in with you every couple of years to say, hey, are you still disabled according to our policies and according to our regulations? Can you still no longer work because of your impairment? And the form you get in the mail historically is a panic-inducing form because it's 14 pages long. It is your lifeline to continue to receive your benefits. And it asks a ton of questions surrounding your current impairment, what doctors have you seen recently, what prescriptions have you taken recently. And that can be genuinely overwhelming for somebody who is sort of living on the margins of society already. But we had this listening session, and we had people who had been through this process come to us and tell us about how this form was almost as bad as the impairment that they experienced that had caused the disability in the first place, right? And obviously that may have some rhetorical flourish to it, but the sincerity of feeling like my life is hanging on the balance of being able to complete this paperwork is something that I try to retain in everything I look at every single day. And so kind of guided by that really emotional valence of the stakeholders who come to us with this experience, I tried to sit down with the agency and think about how can we try to improve this process? And the first part of how to try to improve this process is let's talk to more people, right? And so we worked with Social Security to go back out to the public and to try to get more feedback on what was working and what wasn't working on this form. SSA then went out and did a bunch of additional user experience research where they brought in legal aid organizations, they brought in individuals who are currently receiving disability benefits, and just like Andrea described, right, they sat down with this form and watched people go through the process of filling it out and watch where they paused and how they may not know to answer a question correctly, or they may have follow-on questions that aren't clear about the page. And overall, across a process that actually took like well over a year, the agency ended up building, for the first time, a digital product, right? So now you don't just get a paper form that's 14 pages long. You can just get notice in the mail, log online to your account, and actually complete it digitally. But way more cooler than just digitizing this product are all these other little tweaks that the agency took along the way to try to make this process a lot better. So the core one that I really latch onto is SSA already knows so much about your disability if you're already on their program, because you've already applied into it and you've already provided a bunch of evidence. And so now they actually port in data that you've previously provided about the doctors that you visited, the medications that you've taken, the impairment that you have. So it's already partially completed for you, and sort of your responsibility is just to flesh that out a little bit more. And then the agency also just took a whack at questions that I think maybe made sense when they were originally thought of as part of this form, but really weren't operating as originally desired. And so my role in this process, right, is just like literally a role in the process, and there are a lot of people involved in this. But it is to take a question like on the form was, what are your hobbies or interests? And this was sort of the bane of many advocates' lives, because you would hear these stories about people who would get this form to recertify for their disability benefit, and they would get to this question and they would have no clue how to answer it, or they would say things like, I love to fish. And then, that goes back to a bureaucrat somewhere who sees this and sees describing an impairment on the one hand, and then describing a love of fishing on the other hand, and think this person's not as disabled as they're suggesting, and they may take away their benefit, right? But what you actually learn when you explore that process a little bit more is that they love to fish, but they haven't been fishing in a decade because of their disability. And so, my role insofar as in its most optimistic sense is to take little questions like that may seem super innocuous and try to dig deep and try to understand what is the human at the end of this trying to actually answer here, and does it make sense? And if it doesn't make sense, or if it's causing more problems than sort of the benefit it serves the agency, then we can work together to rephrase it or strip it out, or otherwise make the process better. So, again, like you said, Jordan, it's definitely, it can be an invisible role, and it only is a functional role because of like the work of a lot of other people. But it's a really satisfying role when it works out well.
I mean, Paperwork Reduction Act, like just the 3 words, they almost make you want to yawn, but like there's so much behind that. It's incredible. Like, it's not just about less paperwork, but about making a much better experience. Thank you for walking us through all that. It's fascinating.
If I can comment on the Paperwork Reduction Act quickly, like it's one of those things, it's like panic inducing for federal government employees, but we also all understand why it exists. Like, it's so important that we don't ask questions that we don't need to, and that we are like very aware of the burden that we're putting on the public whenever we're collecting information. But it also ironically creates a lot of paperwork.
Specifically, it really does, right? Because part of like what an agency has to do then is they have to explain and rationalize every question they're asking theoretically, or describe the experience of somebody going through this. And so exactly like Andrea said, it is not known as the Paperwork Reduction Act among agencies, because they actually have to generate quite a bit more paperwork to sort of get it through the hurdles of our review. And there are trade-offs there, right? It's not always a perfect process, but when it works right, it's very satisfying, I think.
So Kyle, you mentioned that some people who were going through this process said that filling out the form was almost worse than the experience that led them to fill out the form. And on the flip side, Andrea, you said your goal is to make it so that people have a delightful experience when they come to a government website. I'll ask this to both of you, but let's start with Andrea. Like, how do you see delivering a better experience as impacting people's trust in government? I think it's no secret that generally speaking, public trust in government is not as high as it could or should be. Like, how do you think this plays into changing that dynamic?
Nobody likes a terrible government website. Nobody likes going to a website that feels old and clunky and they can't find the information that they need. I think building better government websites, or as you know, you'll often hear the techies in government say, fixing the damn websites, is key to rebuilding trust in the federal government and to showing and demonstrating to the American people the value of the federal government. Because so much of what we do is online now, you know, in today's society, it's important that the government is not only online, but best in class online, that we are delivering, you know, a delightful experience, but delivering what people need in an easy to use format, and that it's quick and the communication is clear, and you know what you have to do as a citizen to get the services that you need. It's absolutely critical. I keep going back to like, you know, Kyle was talking about like people filling out these forms. When you fill out a terrible government form, you have I have a physical reaction whenever I have to do it. Like I have a physical reaction to it. I'm like, ugh. And when you don't, you're like, oh, that wasn't so bad, right? Like that wasn't that hard. I can do that. Is the reaction that we want people to have. So I mean, it's a great question of like, why is this important? Like to me, it's everything. It's how the government functions nowadays. It's how we interact with the public. You know, it's through these services that we're providing, and often that's online. And we have to have you know, best in class and world class websites and user experiences in order for that trust to be rebuilt.
Yeah. Kyle, I'm wondering if after the changes you helped Social Security make with these forms, like, did that feedback change in a significant way from this was worse than the injury that caused me to need the form to like, that wasn't so bad?
Yeah, so that's, again, you know, being within OMB, my like deep paranoia is you can feel like really pat yourself on the back and think you've done a good job, and then like find out a year later, like, no, you completely missed the boat on it, right? And I think what's actually been satisfying about this particular one is I have checked back in with, you know, legal aid organizations a couple of times, and like just people say, you know, the agency did a really good job delivering this new form. And, you know, I was just talking to SSA about some of the stats on this the other day. And I think like in its first year of deployment, 60,000 people filled it out. And I'm not going to give a percentage about what that is of the total because I don't know it off the top of my head, but it's like some meaningful percentage of all the people having to complete this are now doing it online. And it saves them time and it saves the agency time, right? They can process these so much more quickly and affirm to somebody that, no, you're still eligible if that's the case, right? And I think, you know, that gets at what Andrea is talking about as well, which is like, people, I think, actually have a very good understanding of the government. Like they get that it's reasonable that it takes a little bit of a longer time than the private sector. They get that it's going to be a little bit more legalistic and a little bit more bureaucratic than the private sector. But you don't want people to lose a sense of autonomy, right? You don't want people to feel like you got 3/4 of the way through a form, an online platform, and then it crashes, or you can't do the correct data inputs because it's so poorly built. Or you don't want a situation where you submit something and then a month later, you still haven't gotten any response or update about what the progress is, right? It's all these little things that make you feel lost and out of control that are problematic. And in fact, I think a lot more problematic than being told at the end of the day, actually, you aren't eligible for this thing that you applied for. You can't get this service that you requested because like you didn't qualify for it, right? And there's research supporting that, which is that when people are denied benefits but feel like it was a good process, they actually still have a high trust in government. You lose trust in government when things are out of your control or when you don't have a clarity regarding when it will sort of end. And so that's, you know, again, the challenge with government is there are so many forms, there are so many programs, and there are so many, you know, resource constraints and other types of constraints that are faced. And so there are, you know, very meaningful programs and agencies right now that would certainly benefit from, you know, more support. But at the core is trying to, I think, instill that sense of autonomy and build for platforms, build forums that can support that as best as possible.
So one of the things that we try to do with the emerging leaders part of Sammies is to help people see a way that maybe there's a path to public service for them, or what public service could look like for them. So I want to zoom out and talk to you both about your journeys to public service. Andrea, I'll start with you on this one.
Yeah.
What called you to public service?
So I came into public service mostly because of COVID-19. I have a background in public health. My educational background and my career previous to this was actually in international development. So I've worked on health information systems for a really long time. And I think COVID-19 was kind of my moment where I was like, oh, I can help, right? Like I have the skill sets and the background to be able to like step into a pandemic. I've worked on pandemics before. I worked on Ebola in West Africa. I've worked on HIV in Sub-Saharan Africa for many years. And I remember just thinking like, put me in, coach, a little bit of like, okay, here we go. Like, America has really got to rethink the way that we're doing things in healthcare data systems, how we communicate with the public, because we had a bit of a communication breakdown. I don't think that's controversial to say, but that COVID-19 kind of showed us in our healthcare system where we lack information, where we lack data, where we are lacking communication with the general public, and that there's a lot of work. We're going to have a long journey forward on really rebuilding that trust, building better communication channels, and building better information and data sharing across both the federal and state and local governments. Because, when the next pandemic comes, I know nobody likes hearing that, we need to be in a situation where we're, doing all of those things really well.
Thanks. Kyle, what about you? What brought you to public service?
This question's come up a couple of times during sort of the SAMI process, and I always feel like I have the lamest answer, which is that like I have literally always wanted to work for the federal government as long as I can imagine, and it's just like I definitely blame my parents for that. I think they just kind of instilled in me an interest in current events and like a desire to help others through public policy. And sort of once you say that's what you want to do, there's no place that's better to be than I think the federal government, right? Now getting to the federal government can be a pretty tricky thing in and of itself, but I think probably from like the age of 13, I knew that I wanted to work for the feds.
So as somebody who has thought about this for a long time and sort of oriented yourself in that direction, like what advice would you give to young people who might be thinking,
good question.
I don't know, maybe the federal government could be for me?
So I'll take a quick first stab. I think, the first challenge that I personally experienced was, you go to college, obviously, and I just like, opted for political science for like a total lack of knowledge about like, how that would actually advance me forward. And I think I would really recommend looking into, internship opportunities in the executive branch, right? So I did a Hill internship, and that was a lot of fun. But if you're actually trying to think about, career pathways in the federal government, again, the feds can be a little bit slower than private companies to like when they're advertising their internships and stuff like that. But like at its core is that ability to have sort of a faster lane in to understand like, here's how an agency works. Here are contacts and colleagues and friends that I can make along the way. And so I did not do that, right? But if I were to do it all again, that's what I really wish I had sought out was internship opportunities during the summers of my undergraduate years. At the end of the day, like most of us as feds apply into the government through USA Jobs, which is our government application portal, and that can be a really trepidatious process, and it can kind of feel like you're throwing your resume into the void without having sort of a sense of who is picking it up on the other side. And so again, those types of opportunities like internships are the way that you can sort of feel confident that like actually no, I know this team within the Department of Transportation, or I know this team within HHS who sort of recognizes my name, can keep me abreast about how this opportunity is posted. So that would be my top recommendation is sort of those network opportunities through internships and the like.
So you talked about like making government feel
Make it feel smaller.
Smaller
Yeah.
for people. Like, are there any like top tips? The internships is a great one, but do you have any other top tips for like how to make that daunting process of applying for a federal job feel a little smaller?
I'll take a quick stab at that, Andrea. I'm glad to kick it to you. So, I mean, the other half of my story, right, is like I went to grad school for public policy, which was much better targeted than just like political science. And everyone says in like grad school, you go to it for the relationships that you build, right, not like just the educational aspect. And I was like, yeah, sure, that's fine. But then that's exactly what happened, right? I had a friend from grad school who reached out to me about 2 years after grad school and said, hey, I'm working in this really cool organization. That organization was OIRA. I think you would really like it here. And so again, right, that I could have gone my entire life without knowing that there was an agency within the government who was like responsible for looking at like cost benefit analysis and regulations. And that was like my dream job, and I didn't know it existed, right? And so it really is, in a organization of millions of people, it comes down to just getting to know people who are inside of it, who can then let you know about opportunities that are out there, or let you understand actually what it means to be, whether it's a program administrator or a data analyst or a researcher, sort of providing some tangibility to those actual experiences, because it just is so, I think, sort of inherently cryptic from the outside. But Andrea, I'm very curious about your perspective.
Yeah, I mean, so I work in healthcare. My background is in healthcare and technology. Those are my sweet spots. I mean, also government. But for me, I think it's figure out an area that you're passionate about, something like healthcare or, like transportation is a great example. But even, within services, like, is there something that you had an experience with in your life that you think you should be better? So at HHS, we work with everyone from the FDA and the NIH to the foster care system, right? Or, is there a government program that you were involved in that you would like to make better? And then start looking there, because bringing your own experience into it makes you you have the perspective, right? You have the experience of working in these systems, of living through it, and really focusing in on what program or what aspect of the government would you like to be a part of. So for me, like I said, I'll go anywhere in healthcare, send me somewhere in healthcare. I came in through a program called the U.S. Digital Service, which brings in technologists, and that's how I kind of came into the government. And there are lots of programs like that. I think having some skill sets is really helpful. So, learning data analytics. Everyone needs people who can analyze data, learning how to build software, learning how to build technology, be a user researcher, go take some classes and figure out how to go, do user research with people if you like to talk to people. I think having a couple of great skill sets is super helpful, because that's what we're often like doing work, right? Like we have to build things and change things, and we need people who have the skill sets to do that. So that would be my advice. That's the path that I took. I, kind of spent a lot of time working in healthcare, and globally, I worked all over the world in different healthcare settings. And so I think coming into the federal government for me, I was able to come in with a lot of experience and a lot of skills from actually doing work on the ground. And that field experience is super helpful when you're thinking about how to do things differently. Coming in with experience is even if it's just like a little bit, even if it's an internship or a small amount, is something that I think we often look for.
So, pulling on this a little bit, what do you know now that you wish you had known at the start of your public service journey?
What do I know now? I've known this for a while. Things take a lot longer. You want it to like happen right away. And it takes a while to make big change in government. These are big, complex systems that affect millions of people. And so sometimes it moves slowly because it has to move slowly. It affects millions of people, right? At Medicare, we provide health insurance to 160 million Americans, right? That's a lot of people. And so sometimes I find myself having to like take a deep breath and being like, it's okay that it's moving slow. My natural tendency is to want to move faster. But that's what's kind of fun about government, is like the impact that you will have, even though it might take you a while, is incredible. Like the mission is so big. There's so many people affected by your work. But yeah, I would have told myself it's going to take a little time, and that's okay.
Yeah, just to build off of that, I think it's exactly Andrea's attitude though, which is that like, it's good to go into the government with a dissatisfaction with the slowness, but then a tolerance for it at the same time, right? Because like you always want to be somebody who's pushing things forward and saying like, no, we should be moving a little bit faster, or like, this barrier is an unreasonable barrier and we need to find a way around it, right? So you can't just sort of get mired in the status quo, but like you also, I think some of the best people I know who like dipped their toes in government and then left, maybe didn't have the sort of ability to like sit back and accept like, yeah, it is the case that it's going to be slower than it is in the private sector. And again, like Andrea said, right, when you are changing public policy, you're building consensus across like dozens to hundreds of people who are representing organizations of hundreds of thousands of people who are then serving millions of people, right? So like, of course, it's going to be slower than some like private sector, where the goal is just trying to sell something a little bit faster, right? But that's okay, and it's natural that it's a little bit slower. But it is so satisfying to get those wins. And the last thing I'll say is
they feel better because you've worked harder.
Yeah, is like be somebody who gets to yes, right? It's there are so many ways you can come into a government job and say like, no, like somebody approaches you about an idea and you can explain to them like 10 ways why it won't work. There's always going to be a funding issue. There's always going to be some, unknown statute that you haven't heard about before that you have to figure out some way to satisfy. Being able to say those things are all true, but like we can still find a solution is like critical. And then surrounding yourself with people who are also like that is like very, very satisfying and a good sanity check when things like don't go your way, and like they're not going to go your way plenty of the time.
I think that is a pretty good place to leave it. Kyle, Andrea, thank you both for joining us today, for the work that you do. Congratulations on being Sammies finalists. We're excited to be able to recognize you and your work. For those watching, you can learn more about Andrea's work and Kyle's work by reading their profiles at servicetoamericamedals.org/honorees. And while you are there, although we have not yet announced the winners of the 2024 Sammies, voting continues for our People's Choice Award. Earlier this week, we unveiled the top 6, and you can vote now through July 12th for your favorite finalists. Just go to servicetoamericamedals.org, click on the People's Choice button, and cast your vote. We'll also put the link in the chat here. Be sure to learn more about each of the finalists and cast that vote. You can vote once a day. We will announce the winner at the next event in our Sammy Summer Series on July 24th. So that's it for today. Thank you again to Kyle and to Andrea. For the Partnership for Public Service, I'm Jordan Lapierre. Thanks for watching.